And I know some of you have probably heard my spiel before on MST, so I really want to make sure this meets your needs for what your interest is, because as Mike and Renee know, I could talk about MST for 3 weeks without stopping. So I need to have some breaks on my mouth sometimes. So I want to hear what you would want me to cover. And if you haven't had an MST overview before, you may not know. But if you have, um, just go ahead and please feel free to shout out your questions, and I'll make a note of that because I shared a really ridiculously huge slide deck. But there's no way that I could possibly cover all that in a little 15-minute period of time. So I want to make sure that I talk about what you want me to today, and then you can always look at the slide deck at your leisure, and you can always reach out to me at the end of the slide deck. We'll have my email. So you can always reach out to me if you want to talk more about this and see if this is a good fit for your community or have questions that I didn't answer. But hopefully I gave you a minute to think. So anything in particular you'd like me to cover about MST, which stands for multisystemic therapy? And you could also put it in the chat if you don't want to shout out. I understand that. It's a big group of people. And then I'll ask, like, if people, don't shout out anything right now, Renee and Mike, just let me know, stop me and just say, hey, they want you to cover this or this. Okay. Yes, Angela.
So I live in a county where MST is limited as far as who agencies, like it's usually you have to go through the county or through juvenile court to refer to MST. So can you share with me, because I do have connections with those agencies, what kind of youth, give me like a hypothetical youth that you would refer to MST?
Great question. Cool. That's a great one. And what county are you in, Angela? Are you in Cuyahoga County?
Yes, ma'am. Yes.
Okay. Okay, great. Cuyahoga County is a unique county, as we all know, in many ways. Um, so that's a great question. Okay. Oh, there's great questions coming through. I love this. Okay. Directory. Yes, there is. Yes, to know who, yes, there's a directory of where you can find who to make a referral to. So that's another great question. How do we prioritize our referrals? Great. Okay. Cool. Well, I'll just start talking, and then and you will see there's lots of information in the slide deck. But in Cuyahoga County is a little bit unique. We only have MST in 13 counties across the state, so you know my job is to help communities who want to implement MST to be able to do so. But we have a long way to go. When we started out at the Center for Innovative Practices, we started out as a center of excellence back in 2000 with the state's goal of being that we would have statewide MST expansion. But um, there's been a lot of barriers to that. So in Cuyahoga County right now, there's two providers for multisystemic therapy. So there's Cuyahoga County Juvenile Court, which has had an MST team for almost 30 years. And then they also contract with Applewood Centers to serve youth who are court involved. And as Angela said, there's just not even enough staff, right, to be able to serve all the kids in Cuyahoga County who need it. So let me get to the slide um, that specifically speaks to the referrals. And actually, what I'll do is I'll start screen sharing. Um, okay. Does that look right? The screen? Okay, great. All right, let me navigate to the right. Oh, this is what I should have checked. How do I go to the next? Okay. Why am I forgetting how to advance my slides? That's interesting. Okay. Oh, here we go. Okay, so here's the youth. You can see the slide where it says which youth are appropriate. So it's adolescents, typically for standard MST. We call it standard MST. That's MST for youth with serious behavior problems. That can also include substance use issues that are causing problems, like maybe arrests for possession or getting into problems at school. because they're maybe smoking marijuana or coming to school drunk, those kind of things. But in Cuyahoga County, typically the kids who are able to access MST are pretty deep end kids. We don't have a community provider that is open to like kids who are being referred by the CME, for example, in Cuyahoga County. There's some of our communities that are very opened up to anybody, parents can make a referral in some communities. Like in Franklin County, it's same day access through the Buckeye Ranch. Parents could come into the assessment center and say, I need MST. In Cuyahoga County, unfortunately, we do not have that. So it is your deeper end kids. The juvenile court team serves felony level youth. And then the Applewood Centers team works with kids who have misdemeanors. And the slides here, I mean, I think every MST provider typically has to do some triaging with cases. So if youth are involved with multiple systems, as all of you are here to hear about, they are much more likely to be able to get a first come, a slot quickly. So if a youth is at high risk of being placed, whether that be by children's services or juvenile court, and in Cuyahoga County, it would be juvenile court, or the CME is getting ready to place a youth. If we could get MST in place and avoid that youth from going into placement, that would be a kid that we would prioritize, um, because it is, a very intensive service, and it really is designed for kids who are really deep and involved with the juvenile justice system typically. Um, and so that, I think the other thing I want to talk a little bit about, so it's really common for our youth to have co-occurring issues and needs like depression, anxiety, ADHD, trauma symptoms. Those are things are very, very commonly co-occurring. However, there's some youth that MST would not be the most appropriate treatment of choice for them. For example, youth who are living independently, because MST is really standard MST, which is the program that we have most of in Ohio, is really designed to work with the adults in the youth's life, really helping that youth make the changes in a sustainable way. So if a youth doesn't have a permanent caregiver, like say they're in foster care and it's not expected that that child will stay in foster care with the caregiver that they're with, then it would be appropriate to make a referral when that youth is transitioning back to a permanent caregiver. Hope that makes sense. Because really, a lot of the change influence is coming from the adults in that youth's life. So if the adults change, then that some of that treatment progress may be lost. So the other thing is, and then if youth have really more severe individual drivers, we call them fit factors or drivers to their problem behaviors, then they may not be appropriate for MST. They may be appropriate for something like IHBT. That's, in that case. But in a shorthand way that we sometimes talk about it, and it's not really fair completely, but the more willfully defiant kids are, the more appropriate they are for MST. Like our treatment model was kind of designed for the most oppositional defiant kids on your caseloads that are like, F you, I'm not going to individual therapy, right? I'm not. And kids that would just really won't engage in individual therapy, oftentimes because of the treatment design, we're able to get some really good change because we work a lot with the adults in the youth's life to help really strongly encourage them to make some changes and find out what motivates them. So in many communities, with the exception of Cuyahoga County, they're able to come through lots of different doors. But then, as somebody else pointed out, they do tend to get prioritized by if they're multi-system involved, if they're really at high risk of placement. And so sometimes referrals coming from individual mental health providers um, may not be able to get in quickly enough. We just don't have enough capacity in the state of Ohio, even in the communities where we do have MST, to be frank with you. And then in the slide deck, um, there's a link to our website at Case that has you can click on if you look up even Google MST Ohio Case Western Reserve University, you should come right to our homepage. And I've got linked in there a spreadsheet with each community that has MST and who are the people that you can make a referral to. So like some communities, there's just an email where you could just send your referral right away. Um, so what, I don't know if that, does that help answer some of the questions? Okay, great. What other questions does the group have that I can help answer? If not, I'll just talk a little more, if that's okay. All right. We've got MST all over, just not enough in Ohio. I mean, one of the things about that is, I mean, one of the things that's interesting is MST is a really, as you will see in the slide deck, is a really intensive quality assurance program. And so with quality assurance, we do weekly consultation, quarterly training for teams and therapists, and we do that through the Center for Innovative Practices at Case. That does cost money, right? So, one of the things right now, like Aetna's giving case rates for intensive home-based treatment, which is fantastic and really is a game changer to make these programs more possible for providers to do, but we get the same case rate, even though there's more expenses. So that's been a little bit of an issue that's made it a little bit challenging to encourage providers to want to do MST because they'll get the same case rate if they do IHBT in general or MST, which has more requirements and has more training and consultation as a part of it. But here's a list of where we have MST programs in Ohio. So as you can see, we have a really, really far way to go. And I see somebody had something in the chat. Renee or Mike, could you read that out to me? Because I know if I try to click on it, I'm going to mess up the whole slideshow.
I'm not sure what you're looking for in the chat, Maureen.
Oh, I just saw a question come up. So maybe it was just to me
Oh,
individually.
Sharon asked, is there a directory of MST programs? And
Got that.
I think you've talked about that. And how do we prioritize our referrals, like Angela was saying in the beginning? And I
It's
think
the link.
on that.
He added the link for
Oh,
MST
oh, well,
Ohio.
there we go. Thank you,
Oh, was that
Angela. See,
okay? Thanks, Angela.
Angela needed to get us on course, which I so appreciated that she did that. And
And
Angela, there's the Cuyahoga County MST team and leadership through the juvenile court. They just got an award for their wonderful commitment to MST over the decades. Thanks for sharing that link, Mike. I really, really appreciate that. Um, I'm going to do good work on engaging families. And I think, when I ran the data, we just had our 25th anniversary celebration for MST in Ohio. Um, when I looked at the percent of youth who closed due to lack of engagement in services, it's 5% over 25 years. So 95% of our families complete, they don't end treatment because they're not engaged. So that's really impressive. And we do a lot of good therapy, I would say, right? So a lot of those things that are our keys to engagement, our treatment model is designed to engage families, and then we really adhere to principles of treatment that are what we know to be really helpful for engaging families and making treatment possible for families. And when we're able to engage families in treatment, when we're able to prevent them from going to placement, to address their behavior issues, communities can see really, really, and states can see really, really big cost savings. And so, actually, one of the things we're working on right now at the Center for Innovative Practices at the Center of Excellence at CASE is looking at how are we doing with these kind of programs like MST and other IHBT programs. What is Ohio saving by investing in these intensive home-based programs like MST, and instead of sending kids to placement? So hopefully, we will see nice cost savings like Pennsylvania, $50 million in cost savings. They have a lot of MST and they have MST across the state, pretty much in every rural and urban area. They do things a little differently. They don't require licensure for all of their staff, so they have an easier time staffing their teams. And then New Mexico also doesn't require licensure, and they have really big cost savings. Um, but MST does have a very comprehensive suite of services, which is part of what leads to the cost savings as well. We don't have to refer out. And I'm just going to say a couple more things. about what our services are. I'm going to skip some of these slides. Um, and I just want to talk about we really, MST is a treatment model that kind of is packaging what has been shown to be most effective with this clinical population all in one package. With the exception of the MST team itself does not prescribe medications. We don't have any MST teams that have nurse practitioners or physician's assistants or psychiatrists embedded in the team. We used to, but we don't have that resource anymore. So our clinicians, if they do an assessment and determine that a youth could benefit from medication management, we will work to connect that child and family with a prescriber that can assess if that would be helpful and monitor the impact of that intervention. Um, so that's a whole bunch. I'm gonna stop now because I could talk all day and I know you guys have a case presentation.